And from the very beginning, when you look at the trajectory of the past year, a lot of questions about our healthcare system and about our hospitals and how they are navigating their way out of it. What have you seen?
Eamon, that's right. Hospitals across the U.S. are navigating how to reopen up to visitors, each coming up with their own rules, in some cases limiting visitors entirely, restricting visiting hours, not allowing children in some cases. Now things are changing, and now colleagues of mine across the country are clamoring for standardized policies from the CDC, because recent studies have shown that such visits can actually facilitate recovery, especially in critical illness.
As hospitals reopen to visitors again, a hodgepodge of visitation policies is causing confusion and frustration.
They'd say, wait a minute, you can go in there safely, why can't I? And I had to say, I don't have an explanation for you. I disagree with this policy.
16 months into the pandemic, doctors are learning how much family visits impact the actual health of patients. A recent study looked at delirium or extreme confusion in more than 2,000 critically ill COVID patients. It found family visits lower the risk of delirium by around 30%. Dr. Wes Ely is an ICU doctor at Vanderbilt and co-author of the study.
Families are not a luxury in care, and they're not an accessory. They are absolutely part of the treatment plan. Part of our prescription for healing needs to be family at bedside.
20-year-old COVID patient Daniel Amon was in the ICU in April. His mom, Diane, not allowed inside his room.
I had no way to communicate my needs.
Looking back on it, I don't really know how I got through the day-to-day of just sitting there and watching.
She could stand outside his room, but only for 2 hours a day.
If I had a loved one right now in that bed, could they hear me?
They can't hear you, Dr. Gupta. And not only can they not hear you, but then they also miss the touch and the eye contact. So standing here outside this room, you might as well be on Mars.
What about the role of technology? Could televisits be the solution?
There's no doubt in my mind that we need to use these moving forward for people who want to meet with a loved one in another country, in another state, who they can't get to them quickly enough. But I don't want it to be a crutch or a substitute when we can have the families actually in the room.
Once reunited, for mother and son, the difference was clear.
Having the emotional boost of like a familiar face that I could actually touch and not just see on a screen, I'm fairly certain helped me get out of there a whole lot faster.
Many experts are now calling on the government to set national standards for hospitals to make visits safer, less restricted, and more fair.
Scientifically, we know how to do this. So to me, it is completely inappropriate, anti-medicine, and a threat to dignity of humans to keep these families separated from their loved ones.
And to your point, this is actually a risk factor for death.
I think it is.
In addition to reducing a patient's delirium, studies have shown that family visits actually lower anxiety. They reduce the overall length of stay in the ICU and ultimately result in better care. Eamon?
Yeah, Dr. Gupta, great reporting there and great insight. I guess one of the questions I have is, do we need to, at this point, have hospitals, mandate that visitors be vaccinated? Could that be something that helps with the overall healing of the patients they have on the inside?
I think that, Eamon, that will help with standardized policies across the country. What you're seeing in neighborhoods is one hospital has one approach. Down the street, they have an entirely different one. I've actually seen families clamor to have their patients, their loved ones, transferred from one hospital to the other so that they can actually be in their loved one's room. So yes, actually mandating that family members get vaccinated will make this easier. Whether or not we should expect them to show proof, that's an entirely different, much more hot button topic.
Yeah, absolutely. Very important point. Dr. Vin Gupta, thank you so much for that reporting. Greatly appreciate it.